Hi, my name is Meghan Skief. I'm a family nurse practitioner student at Maryville University. This is my head-to-toe assessment for my advanced health assessment course. This is my patient, Dan. Prior to entering the exam room, I've had him empty his bladder. I've also taken a full set of vital signs and a height and weight. I also had him test his distant vision with the Snellen chart and near vision with the Rosenbaum's chart. So to start the exam, I'm going to ask Dan, just look straight ahead. I'm going to look at his skin on his face and on his scalp. I'm going to look for uniformity throughout. I'm going to look for symmetry of the ears and eyes. I'm going to look for the shape of the skull, make sure it is even. There's no dentations or any contours that are visible to the eye. I'm going to ask him to clench his teeth, smile, stick out your tongue, squeeze your eyes closed, wrinkle your forehead, puff out your cheeks. Good. All right. Next, I'm going to start with palpation. I'm going to palpate his scalp and his hair. I'm feeling for any contours or depressions. I'm feeling for the texture of his hair and making sure that they're distributed evenly throughout. Next, I'm going to look at his facial bones. I'm going to start palpating those first. Any tenderness?
No.
All right. Then I'm going to move on to his sinuses. Any tenderness?
No.
Good. All right. Next, I'm going to palpate his TMJ and have it open and close your mouth as I palpate back here. All right. No clicking, so that's good. Next, I'm going to touch the light sensation on the face. So I'm going to touch this across your face. I just want you to tell me if you feel it equally on both sides.
Yes. Yes. Yes.
Good. Now I'm going to move on to your eyes. So I'm looking at your eyes, eyelashes, and eyebrows, making sure that your eyelashes are extended outward and upward. I'm looking at his sclera, making sure that it is white, which his is. I'm going to also look at his conjunctiva. It's nice and pink and moist, which is good. I'm also going to palpate your lacrimal apparatus. Tell me if you feel any tenderness. I'm also feeling for nodules or swelling.
No tenderness.
Okay. Next, I'm going to move on to testing your pupil reaction. So I'm going to have you look straight at me. I'm going to shine this light in your eyes just to see how your pupils react. Good. Just stare straight ahead. All right, his pupils are equal and reactive. I also did the light reflex test. He's got, I can see the light reflex. It's slightly nasal and symmetrical on both sides, which is what you want. Next, I'm going to have you use my pen light. Just keep your eyes on this and just follow it, okay? Okay. Okay, that was his extraocular eye movements. Tests cranial nerves 3, 4, and 6. I also tested convergence and his pupils that constrict. Next, I'm going to test your peripheral vision. So I want you to tell me when you see my hands, okay?
Yes. Yes. Yes.
Okay, good. Next, I'm going to move on to your ears. So I'm inspecting your ears right now, looking to make sure they're symmetrical on both sides, making sure the size is appropriate and even on both sides. I'm going to start palpating your auricles. Any tenderness when I do this?
No.
Okay, good. Next, I'm going to have you cover your left ear, and I'm going to stand behind you and whisper a word. I want you to tell me what you hear.
Apple.
Good. And cover your right ear, and we're going to do the same thing. I want you to tell me what you hear.
Baseball.
Good. Okay. Next, I'm going to place a tuning fork on the top of your head. I want you to tell me if you hear it equally in both ears or if you hear it in one ear better than the other. Okay.
Both ears.
Next, I'm going to put this behind your ear. I want you to tell me when you can't hear it anymore. Then I'm going to move it outside your ear. I want you to tell me when you can't hear it anymore. I'll do this on both sides.
Okay. Okay.
Alright.
Okay. Okay.
Good. Alright. Next, I'm just going to take a look at your nose. I'm looking to see that there aren't any deformities, that his septum is midline, nose is midline. I'm going to determine the patency first of your nose. I want you to occlude one ear and blow out, and then do the same thing with the other. Good. Any problems?
Nope.
Okay. I'm going to shine a light up your ears and make sure everything looks good. Great. So the mucosa is moist, septum is midline, nasal turbinates are pink and moist, is what you would expect. Next, I'm going to look at your mouth. So I'm looking at just your lips right now, making sure they're moist, that there's no cracking, no sores visible. I'm going to ask you to open up your mouth. I'm going to shine a line in there. I'm just looking at the oral mucosa, making sure there aren't any lesions. Looking at your teeth and the number and any characteristics that I might notice, making sure there's the appropriate number. Maybe you stick out your tongue for me and say ah.
Ah.
I'm looking at the oropharynx to make sure that the tonsils are a normal size, the uvula is midline. I'm looking at your tongue, so have you stick out your tongue again for me. All right, and lift it up and side to side. Good. Looking for any signs of oral cancer. Looking to make sure there's no lesions, anything that's abnormal. Last thing I'm going to do is just test your gag reflex too. It's a little uncomfortable. All right. Alright, next I'm going to look at your neck. So I'm looking at his neck, making sure it is symmetric, it's smooth, there isn't any rash present. I'm going to look for any JVD, which I don't notice. I'm going to have him do a little bit of range of motion, so I want you to put your chin to your chest, and then look up at the ceiling, look to the left, and then to the right. Good. Next, I want you to bend your ears flatter. Okay. All right, and then I'm going to have you do the same thing against resistance. So chin to your chest, up to the ceiling, to the side. Good. And then good. Good. All right. Next, I'm going to have you shrug your shoulders. I'm going to push down while you shrug. Good. All right. So from there, I'm going to palpate his carotids separately first. I'm going to palpate his trachea, make sure that's midline. I'm going to palpate his thyroid. I'm going to come from behind and palpate the thyroid. I'm going to have you swallow for me. Good. Next, I'm going to palpate all your lymph nodes. Let me know if you feel anything tender, okay? So I'm doing pre-auricle, post-auricle, occipital, tonsillar, submental, submandibular, superficial cervical chain, posterior cervical chain. Now you turn your head to the left. Deep cervical chain, supraclavicular, infraclavicular, and then maybe lift up your arms a little bit. I'm going to feel under your arms too. And the axillary. Good. Alright, so now I'm going to listen to your carotids and also to your thyroid. Okay. Next, I'm going to move on to your extremities. So I'm looking at your skin, looking to make sure that there's no lesions, no wounds present. I'm looking all the way up to the shoulder. So that's good. Looking at muscle mass in the arms. Okay. I'm going to look at your fingernails. Testing cap refill. Looks good. Palpating all the joints, making sure there's no deformities, anything tender. Palpating all the way up the arm, the Okranum process, and up to the shoulder. Good. Can you push against my arms? Like, good. Don't let gravity break it. Good. And squeeze my hands. Good. Muscle strength is 5 out of 5 in the upper extremities. Next, I'm going to test your brachial reflex. I'm going to have you just relax your arm for me. Good. Good. Okay. So from there, I'm going to go to your posterior chest area. So I'm looking at his skin on the back. I'm looking at his respirations, any signs of distress. I'm looking at his thoracic configuration. Everything looks good. So next I'm going to palpate for the costovertebral angle. And that's going to help me now with percussing the CVA. So I'm going to just tap on your back here. I want you to tell me if you feel any tenderness, okay?
No.
Good.
No.
Good. All right. I'm also going to palpate down for about the 10th rib. I'm going to place my hands here. I'm going to do this thoracic expansion. So I want you to take a nice deep breath for me. Good. All right, I'm going to feel your back, and I want you to say 99, okay?
99. 99. 99. 99.
Good. I'm going to listen to your, I'm going to just tap on your back a little bit more, okay? Just relax. Breathe normally. Good. Do the same thing over here. So pull your gowns to the side for a second. Good. All right, next thing we're going to do is diaphragmatic excursion. So what I want you to do first is take a deep breath and blow it all the way out. Okay. And just hold it. Okay, now I want you to take a deep breath again and hold it. Don't exhale. Good. All right, you can relax. The difference is about 3 to 5 centimeters, which is what you would want it to be. I'm going to do the same thing on the other side. Sorry. Go ahead and take a deep breath and pull it all the way out. Good. Good, okay. And now I want you to take a deep breath and hold it. Good. About 3 to 5 centimeters, which is normal. Both same bilaterally. Okay, so next I'm going to go ahead and auscultate your lung sounds. I'm going to do the front and the back, okay? So as you take some nice deep breaths. Good. Also on the sides here too. Good. Okay. Also into your breath sounds on the front side too. Continue nice deep breaths for me. Good. All right. So now that I'm on the front side, I'm going to go ahead and look at your front. I'm going to look also for signs of any respiratory distress, uneven labored breathing, which he does not have. I'm going to look for any pulsations or heaving that I might notice on the chest wall. I'm going to palpate for any crepitus. I'm also going to feel for any thrills or heaves. Good. I'm also going to locate your apical pulse. It's on your left side here. I'm going to feel that for a minute. Very good. All right, we're going to do the same 99 thing on the front side. So I want you to just repeat it.
99, 99, 99.
Good. So now I'm going to percuss on the side as well, so you can just breathe normally. Good. All right. So now I'm going to listen to your heart sounds. Everything sounds good. Alright, now I'm going to have you lay back on the exam table here. We're going to move on to your abdominal part of the exam. Is it okay if I pull the hair down?
Mm-hmm.
Alright. So right now I'm just looking at any characteristics of the abdomen. I'm looking for color. I'm looking for contour, pulsations, any movement that I might notice. Then I'm going to move on to auscultation. I'm going to auscultate all the vowel sounds first and then move on to his arteries. Now I'm going to listen with the bell for arteries. I'm listening to your aorta, renal, iliac, and then your femoral. Good. Now I'm going to percuss your belly, okay? Looking for any tone. Good. Next, I'm going to palpate his liver border. So I'm going to come over to the right upper quadrant. Just going to come up from the midclavicular line of the umbilicus. Just palpate upwards to like your dullness. I'm going to come down a little bit. I'm also going to percuss for the spleen. For spleen dullness, you do not want to hear that. Good. All right, so now I'm going to move on to palpation. going to start with light palpation first. Feeling all over for any tenderness, masses, anything abnormal. And I'm going to just go deep palpation all over all 4 quadrants. I'm palpating over here for the spleen. Can you take a deep breath for me? You don't want to be able to palpate the spleen. It should not be palpable. I'm also going to do the same thing over here on the right upper quadrant. I'm going to have you take a deep breath. Good. All right. Next, I'm going to palpate for your left and your right kidneys. Just put my hand under here. All right, now I'm going to feel midline for any aortic pulsations that I might feel, which I do. All right. So you can come up to the edge of the table again. Now I'm going to look at your legs and your feet. I'm looking for color of your legs, looking for any lesions, any wounds that I might notice, which I do not. I'm going to look at his muscle mass and his hair distribution. Hair distribution looks even, muscle mass looks good. I'm going to start palpating here. While I'm palpating, I'm feeling for temperature. I'm also looking for edema, which I do not notice. I'm going to go ahead and feel his popliteal pulse. I'm going to feel his dorsalis pedis pulse and his posterior tibial. They're all +2. I'm also going to have you, we're going to do some muscle strength tests. I want you to push against me, okay, as I push down. So I'm going to have you push up against my hands, then push down. Push up against my hands, push down. Good. 5/5. So that looks good. I'm going to do some sensation. I didn't do this earlier with your arms. So I want you to tell me if you feel it equally in both arms, okay?
Yes.
And we're going to do your legs too.
Yes.
Here.
Yes.
Great. So now I'm going to test your reflexes in your lower extremities. We're going to do your knee reflex first, so you can just let your legs relax, okay? Good. All right, and then I'm going to do your Achilles tendon. So I'm going to have you just relax your leg. Good. All right. Next, I want to look at your cervical spine. So the best way to do this is to have you stand up, put your back towards me. Have you bend over slightly. I'm going to start at the C7 and come down. I'm feeling for any rotations, any abnormalities as I come down. And I'm going into the lumbar region right now. I'm feeling for any rotations or abnormalities. Okay, good. All right. You can go ahead and have a seat back up. All right. That's the end of my head to toe exam. Thank you very much.